this session, so they'll be uploaded to our YouTube channel for people to see later. And if you're needing CEUs, this is one of the sessions that you can get CEUs for. At the end of the session, I will put a link to the Google Doc that you can get your CEUs from. If you're attending more than one today, you only need to do it once at the end of the day. We are not charging for this, but we are going to recommend that professionals who attend consider donating $10 to the School of Social Work Scholarship Fund. And I've put that link there in the chat. And then at the end of the session, I will put your CEU link in there for those of you who need it. So I see that May Cruz is on here. May, do you want to pop in? Are you ready?
Hello, can you hear me?
Yes, we can hear you. And May, you do have the ability to share your screen. Let me just tell you a little bit about May. May Cruz has been at the Homeless Alliance in Oklahoma City for 4 years, working towards rallying the community in the effort to end homelessness. And she achieved both her Bachelor and Master of Social Work from the University of Oklahoma School of Social Work. And she is also the Associate Director of Coordinated Entry and Referrals at the Homeless Alliance, and has the opportunity there to connect with clients, to connect clients to resources and build as well as strengthen connections with community partners. And so without further ado, I'm going to turn it over to you, May. I will keep an eye on the chat in case people have questions, and we'll go from there, and we'll end promptly at 12:45.
Perfect. Okay. Are you guys able to see my slideshow on your end?
Yeah, we can see it.
Okay, perfect. Awesome. Well, thank you, Professor Kendrick. As she said, well, my name is May Cruz. I am the Associate Referral Specialist or Associate Director of Coordinated Entry and Referrals here at the Homeless Alliance. I've been at the Homeless Alliance for about 4 years now. And as Professor Kendrick said, I was actually a student at OU, the School of Social Work at OU. And I had the opportunity to do my practicum for both my undergrad and my master's at Homeless Alliance. So I've definitely had the opportunity to see the Homeless Alliance in different areas and be able to gain knowledge and information and be a part of a lot of its growth the last four years. So I really just wanted to give you guys just some information about what we do here at the Homeless Alliance. A couple of things that I'll be pinpointing is our programs, of course, and the resources that we have here at our campus, as well as a couple statistics and the impact of COVID-19, the cold overnight shelters, point in time, and community resources. So a little bit about where we all began. So I really love telling this story about how the Homeless Alliance started. We were established in 2004. And really essentially what it was a group of people having a conversation. And so I really think that's I really always find that very fascinating and really amazed by that part of how impactful advocacy work really is. So essentially what it is was a group of friends or colleagues got together, they were having lunch, they looked outside the window and they noticed that there was quite a bit of individuals who were experiencing homelessness outside. And so the conversation started and it's, what are we doing about this? Is there any resources out there and what can we do about it? And so then, that's where the Homeless Alliance began. After these group of individuals got together and they decided to go to different communities around, different states to kind of gain an idea of strategies and see how their services that were already implemented were working and bring all that information and knowledge over here to Oklahoma City and, start from ground up and bring the Homeless Alliance to what it is today. One of the primary focus here at the Homeless Alliance is, of course, bringing new ideas and research and really trying to bring the community and work together to collaborate in order to connect people to resources, as well as identifying gaps in services, right? The other thing that we've been working on is trying to implement new kinds of employment programs for people who are homeless or at risk of homelessness. And of course, advocating for affordable housing and permanent supportive housing for Oklahoma City in general. So in 2021, we had the opportunity to assist and bring 2,705 people with housing, which we're really proud of, and we're hoping to expand that number within the next following years. But I just really wanted to share with you all that what we were able to accomplish. So a couple of different programs here at the Homeless Alliance that we have. And you might be familiar with some of them, which is great. So we have our curbside, which is Curbside Chronicles and Curbside Flowers. If you ever in downtown area and you see someone with a green vest on, there are individuals that are part of this program. And what Curbside Chronicles is essentially a magazine, a newsletter that we're able to produce, and we have, we have a really wonderful people that work for that program, and they've won several awards for that magazine as well, which is really neat. And so this also gives an opportunity for us to kind of connect the community, right? So there's several stigmas and stereotypes that come along with homelessness, and we just want to kind of find a bridge in that gap while also bringing some positive impact to our community and for people within our served population. And so essentially what Curbside is an employment base, and so what people go out into the community, they're able to get back out. So a lot of people that have that we work with are in this program are individuals who have experienced homelessness for several years, right? So it could be 10, 15 years. And so having and going back to a 8-to-5 job is very difficult. So, this is kind of also helping them kind of get back into the idea of budgeting and what does, reaching self-sustain means to them. And so that's really neat. We also have our Curbside Flowers, which is fairly new too. It's really cool. We have a shop now. They have different occasions. If you guys are ever close to downtown area, if you want to check it out, please do. It's really neat, and also a way for you to interact with our community. They are now expanded to doing various floral arrangements for like weddings and special occasions, anything like that. We do have a time for like Mother's Day and Valentine's Day and things like that that we're able to bring into the community. But every single flower arrangement that is created is by someone who is currently experiencing homelessness or has is transitioning from homelessness to self-sufficiency. So if you ever have a chance to go check that out, I definitely recommend. And they're all really wonderful, and it's also an employment-based program that we have. Next, we have Sasquatch Shaved Ice. And so what that is we work primarily with at-risk youth, which is really neat too. And it's also in the downtown area if you ever want to check out. It's getting warm outside, which is fantastic. So definitely go check them out. And it really is a really wonderful program to help these younger folks that we have who are experiencing homelessness, in a way too, to help them, get able to figure out how to do budgeting, saving, things like that for their future. We really work with them. We also have been linked up with other community programs that help meet some, form of income or things like that for them. And so that's really great for them. And they're able to graduate from this program and have some form of savings, whether it be for school, whether it be for, getting into an apartment on their own if they're aging out from, so a lot of people coming in are like from foster care systems and things like that. So it's really interesting and really good. And that's really delicious. So if you ever see them, definitely stop by. They have really good flavors and it's really good. So check them out. The other program that we have here is called Building Foundations, and they work primarily with families. The families that are eligible for that program are families who are needing more intensive case management and have some form of disability. So the hope is that, you know, these are families that are coming in with a lot of barriers, a lot of challenges, and are needing more wraparound services. And so we have case managers that can help them with that, whether it be on, you know, daily things such as grocery, doctor's appointments, things like that, and help navigate them with that. Next we have is our Journey Home. Journey Home program is primarily focused on single adults who are chronically homeless and have a form of disability. And when I say chronically homeless is a HUD definition. And so what that is a client has to be experiencing homelessness for a year or longer, or have experienced homelessness for 4 episodes within 3 years that equal to 1 year of homelessness. And I know that's a bit confusing, but that is just, you know, HUD's definition of that. And so that we kind of go by that. Next, Journey Home also works specifically, they have a case manager that works specifically with veterans, which is really great, which I'll show you a little bit statistics on that too. We do have quite a bit of veterans that come in seeking services. And so the hope is to connect them there and then also see if, you know, they qualify for VA services or any other services that they may be eligible for to help get them into housing. Next thing that we have, which is really neat, I'm really excited about this part, is that we've actually been able to embed different housing navigators and other agencies in the hopes of bringing people into housing. So we have community partner agencies that we work with as Restore, Palomar, and the YWCA. So now we have housing navigators that are within the agency that of course are part of the Homeless Alliance, but now not only are you know, individuals able to seek services within these agencies, but if they are seeking assistance with housing, that's another avenue that they can navigate to into getting housing services. So we're really excited about that. We feel like, you know, that we've seen that there is a service gap and people accessing housing opportunities and services and things like that. So we're really excited to have this programs. Next we have is outreach. So a lot of times we have community members that come and talk to us, or, you know, or they're just really concerned. They see someone who might be experiencing homelessness. And so they reach out to us, and we have our outreach team that can go out and try to connect these individuals to services, whether it be through us or through any other community agency, right? So it's really neat. They actually work pretty close. I'm not sure if you guys are familiar with the HOT team. The HOT team is part of the Oklahoma City Police Department. And so they stand for the Oklahoma, Homeless Outreach Team. That's what their abbreviation's for, which it's pretty funny. It's a HOT team. But anyways, they work pretty closely with them, and they're able to kind of bridge that gap too, right? There's always that, like I said, that stigma, that stereotypes, and you know, we've been going through a lot too. We all know that when it comes to police officers and things like that. So that's a way that we can bridge that our community. Next week, which is fairly new, is our prevention and rapid rehousing. I know COVID-19 has impacted the world. However, because of, you know, COVID-19, we were also able to receive some funding, and now we have our prevention team. And so the hope is by our prevention team and our rapid rehousing team is that we're able to get folks who are more in imminent risk of homelessness, right? So we're able to capture people and assist people who are, you know, prior to experiencing homelessness. That is our hope, right? In the way of, you know, being able to, whether it be utilities or rent or things like that, just the hope of capturing those people before they actually end up, you know, unsheltered. And last but not least, we have Fresh Start. Fresh Start is very dear to my heart. When I first started as a student, for my undergrad, I actually worked in this program quite a bit. And so what it is, we have a lot of people that come in who are very talented and you know, are able to create such beautiful art and things like that. And so Fresh Start brings in people from our community, and they're able to paint, they're able to do absolutely anything when it comes to art. And we have the opportunity to display that artwork through showings, and they're able to sell their artwork. So that's just another way for them to get some income. And, you know, and it's, you know, they also feel really accomplished. And, you know, especially when you've been experiencing homelessness for a long time, and you have a lot of barriers, a lot of challenges, and being able to, you know, create something and sell it and make something out of it, you know, it feels good. And so if you ever are interested in that, we do share that on social media. I believe we had one a couple months ago at the DNA Gallery, and they do such a wonderful job. So if you are interested in that, keep an eye out for our next showing, and you can, you know, have some artwork. So just a couple statistics for you guys so you can see how we've been impacting our community. We do have a day shelter here at the Homeless Alliance where people are able to access food, showers, advocates that they can speak to, clothes, you know, anything that you know, initial basic needs that someone may need. So in 2021, we had the opportunity to serve at our day shelter 8,226 guests, which is amazing. We were able to pass out 63,320 meals and 10,583 showers. And the total people we were able to serve, not just at our day shelter, but overall, whether it be through our programs, outreach, any point of contact that we've had with clients that we were able to serve, we were able to get 9,001 individuals, which is awesome. And we really hope that we can continue to increase that. And so the way that we get these numbers and data is we have our own data system that whenever individuals come to shelters and things like that, we're able to get them, you know, get that information in. However, we also do point in time. Some of you may have heard of it. It's something that other states do as well. But point in time, what that is essentially a group of volunteers and individuals of service providers of all Oklahoma City get together. And we do it for one whole day. We start our day at 3:30 in the morning, which is fun. But really what it is we're able to get complete surveys and get data information and things like that. And we do outreach into different areas where either, you know, people have reported camps, shelters, anywhere really that there's someone who may be experiencing homelessness has been reported or that we've seen. And so the hope is that by conducting this research, we're also able to not only see how many people are out there, but also see what service gaps we have, right? So we ask clients, we ask people who are experiencing homelessness or families what they feel we're lacking in Oklahoma City that we could do better. And so that's really important feedback to us because we want to make sure that we're able to provide families and clients the right services that are needed, right? And so we are able to do this. We weren't able to do it last year because of COVID-19, unfortunately. There was and this year, actually, we did have to push back. We usually do it in January and we were able to conduct it in March. So it'll be interesting to see what that data looks like on our end. But that's just another way that we can, you know, gather information and see what percentages of people are out there. And so on that note, I did want to share with you guys some of that data that we did collect previously. All this information is too, if you're ever interested to look at it in more in depth, it is on our website. We'd love to share this with our community because we feel that the more information we can get out there, the better, right?
Right.
Sorry.
We had a question in the chat.
Yeah, go ahead.
What is the coverage area for the services of the Homeless Alliance?
It's just within Oklahoma City area. We are working on, seeing how we can expand that. But for right now, we just are local in Oklahoma City area. We do try to connect to people. If there are, we do get some calls that are calling from, outside of the area and things like that. And we are working towards filling that service gap as well. So hopefully we'll be able to expand more in the future. But for now, yeah. Yeah, so if you guys want to look at this, but I just really wanted to share, on point in time on any given night, we did find that at least 1,500 people are experiencing homelessness on one given night that we were able to collect on. 54% were staying in shelters, 11% in transitional housing, 35% are unsheltered. So that means that they were, either on a street, living in tents, campsites, things like that. And 28% are considered chronically homeless. And so, like I said previously, those that are considered chronically are individuals who have been unsheltered or experiencing homelessness for a year or longer, or have 4 episodes within 3 years that equal to 1 year. Then just on the youth, just because we do have a program that works specifically with youth, I wanted to share with that. So 17% are within the youth age, so 24 or younger. There is, a couple shelters out there that work specifically with youth, like CSU, Pivot, that we try to connect with. But I always like to share that information. Like I always like to say too, is, homelessness does not discriminate against anyone. It can happen to anyone at any given time. And so I think it's really important that we also understand that. So 10% are veterans, and then 17% are members of families with children. So COVID-19 and homeless population. So COVID, it was impacted the world, right? So I just wanted to share a little bit of what we were able to do initially and how it's continued to impact our population. So initially, whenever it first happened, we did see a huge increase of our population. Because there was a lack of accessibility to community resources, a lot of places did have to shut down. Like, for example, there were quite a bit of churches and things like that that provide meals on like in the weekends on a daily basis and things like that, that we're not able to do that anymore. And so clients didn't know where to go or had access to that anymore. Accessibility to mental health and healthcare services. A lot of places had to go, virtual or close down. And things like that, which I feel that's something that we all had to deal with, right? Not just our population. Inability to social distance. So what happened if, you did have COVID and you didn't have nowhere to quarantine? Where do you go, right? Inability to social distance. Limited room for overnight shelters. Shelters had to, limit down how many people they could let in at night. So those are things that we really had to try to navigate and, brainstorm and advocate to figure out how we can best help our population, right? And a couple of things that we noticed too that our clients were impacted by was their mental health. So a lot of people who are experiencing homelessness or families who are experiencing homelessness have a lot of barriers and challenges, right? One of them may be, mental health. And so a lot of things that were difficult and that we try to navigate is the isolation part of it. It was very difficult for clients to be isolated that are within programs or housing. The isolation portion of it was very hard. Disabilities. If you're not able to access technology, if you do not have a phone, then you're not able to access, your medical health provider. You're not able to access your mental health provider. Substance use, domestic violence, access to technology. A lot of times our clients go to public libraries for the use of their computers and things like that, but they weren't able to do that at the time. And so it was really hard trying to navigate that with them. Accessibility to transportation, educational system. Luckily, we really try to connect our families to to our public school system. So whenever, COVID first happened, we really trying to connecting people to make sure that they had the computers for the kids for school, making sure that they had hotspots, things like that, in order for them to be able to access education, or else, you're not able to go to school, you don't have a place to go, you don't have technology. It was very difficult. So those are just kind of a couple things that I wanted to bring out. We really don't think about them when it comes to this population sometimes of, that inability to access certain things that we might be able to access on a daily basis, right? So cold weather, overnight shelter. So luckily the Oklahoma City has really been working with our community, other, shelters and things like that for cold weather. So anytime it gets below 32 degrees, if you ever see someone outside or someone who may be experiencing homelessness, please let them know that, there are shelters that are going to be available. We do not want people outside in the cold. We actually opened up our day shelter to start working as an overnight shelter. It doesn't, that's not something that we usually do, but we realize that it's a need for that. And we do not want someone to get hurt or pass away or anything like that because of cold weather. This year, we did get a couple of ice storms and things like that. So we open up our day shelter for people to come in and stay and have a warm place to stay throughout those nights. So we always have try to make sure that we connect individuals to that. There's other shelters that open up like Salvation Army, City Rescue Mission, all of those. So definitely keep an eye out if you ever see someone, make sure that they're aware of this. But just so you guys can see too, we had at least 1,387 individuals utilize our overnight shelters for cold weather. So we are hoping that, within the next following years, we can expand on that and make sure that, people are getting into warm places and, families and with children and things like that. So we do see quite a bit of people that come in, especially families that say that they're staying in their cars. And it gets cold, and after a while, you can't always keep your car on for the whole night, and so we're really trying to navigate that part of it. So a couple of other resources that we work alongside with, and I wanted to share with you guys, are the following. We really try to work with each of these clients. If you ever come up with someone or even a family member, anybody who may be seeking services, we really try to tell them to go to 211 or call 211. We really have a good relationship with 211 as well. They do assessments and things like that for us, and then they connect those clients to us. Of course, they'll have other resources that they can connect them to. Just because I know we're not always familiar, unless you're working in this field, of course, of what's out there in the community. So if you're ever unsure or you don't know, definitely you can go to 211 online or give them a call, and they can connect you to the right resources. A couple of different, I just put some on here so you guys can kind of recognize them if you ever do. Just so you have them. Of course, if you're welcome to reach out to us at the Homeless Alliance, even myself. I can put my email on the chat for you all if that's something you're interested in. But yeah, that's really all I really wanted to share with you. I also wanted to expand on the, I feel like as a student from, being a student and transitioning over to working here and being able to see the extent of what we've been able to reach, I feel like I should always expand on that to you guys. If you guys are ever interested in coming in as an interns or practicum or anything, like, we are always super receptive to that and always welcome any students who are willing to do, to come in and learn about our processes, or even if you guys just want to tour. We're always open to that. We really like to share with our community and let them know what we're doing, and just create that positive impact. And on a positive note, we, like I said, we really are trying, and the Homeless Alliance, to connect and create new resources in Oklahoma City to help connect individuals faster to housing. I think we all know within Oklahoma City, just finding affordable housing in general can be very difficult, right? So we here as an agency are really trying to continue to advocate to provide more affordable housing and permanent supportive housing for individuals. And of course, we always like to thank individuals like you who are willing to come into, meetings like this or just reach out and willing to listen, right? So I'd like to reiterate the Homeless Alliance started by a conversation and advocacy. So it's incredible to think about what we can do as a community for our population, right? So if you guys have any questions for me, I'm more than happy to answer.
Yeah, I've got a couple here for you, May, in the chat. Wendy wants to know, how do we help consumer access to Homeless Alliance services?
Yeah, so if we actually have a referral specialist that answers our phone calls as well too. So you're more than welcome to reach out to us. And then from there, there is certain eligibility and things like that, of course. But we can at least direct them, if not to us, we can direct them to other resources within the community. But once we get that referral in, you could just call up here, speak to our referral specialist, and they will connect them with our intake team. And once we get there, that's the beginning steps of seeing if they're eligible for programs.
Okay. And this may be a similar question, but Tennille wants to know if you have a coordinated entry direct line for those experiencing homelessness. If that information is available on your website, I'll get your website and put it in there. But go ahead.
So what me and my colleague do is once it goes into the intake, then we can add them onto different wait lists and things like that. So your best bet of getting people connected would be through our referral specialists, just by calling up here. They're also able to call 211 and do an assessment through them, and they're able to connect them to us that way as well. So we actually try to meet, which is something that I do, is try to connect community members together, and we meet weekly on a weekly basis. And so if we have a client that's not able to access services through us, we try to at least get them connected through services in a different avenue. So definitely just call up here, let us know, or have the clients reach out, or anybody who's seeking services, they're welcome to come up here and speak to our front desk, to our, just call up here, speak to our referral specialist, or to our day shelter. There's different avenues of connecting them to services. So we can definitely try to figure out how we can help them.
Caitlin has a question about how long do the wait lists take for someone to get immediate help? Do you have a ballpark?
Yeah, so that's something actually that we are in the works of restructuring a little bit with the city of Oklahoma City, which we're really excited about. Just because housing is very limited too, the wait list can take a while. I will not lie, depending on their eligibility, depending on what barriers, what challenges they have. If I have a family of 6 who has been homeless for about 6 months, and then I have someone, who's a single adult who has income and has just been, couch hopping, there, what I mean? That really just depends on what the situation is, and what programs or openings we have available. So if there's if there's a shelter who has like City Care has certain home, rooms available and things like that. If it just really depends on what we have available to us.
Right.
So I don't really have a exactly like pinpoint, time frame that we can give clients, and we really try to be upfront about that too, so that they are aware.
Yeah. So that probably leads into another question. Melody works in Stillwater, and she said if she had a family that was willing to move to OKC, would they be able to access services there? But it sounds like your wait list may have some effect upon that.
Yeah, and it really depends. I mean, they're more than welcome to still reach out to us too. Like I said, we are working on expanding, to, have more assistance outside of Oklahoma City area. So they're more than welcome to reach out to us still, and we can see how we can best help them. Yeah, definitely just have them call in. If anything fails, if you have questions and things like that, you're welcome to reach out to us or to myself too. And we can, direct you, at least try to direct you in the right direction.
Right. Tania wanted to know if the Housing Alliance operates within the Housing First philosophy.
Yes, we most definitely do. We really try to reiterate that as we follow the Housing First model. We think that by allowing individuals to have that basic need met first, then they're able to address other challenges or barriers that they have. And so we really try to focus on that as an agency.
Yeah. While I'm thinking about it, before I forget, if you would put your email address.
Yes.
I've already put the website in there. If you would put your contact info, whatever you want to put in the chat, that would be helpful.
Of course. And I will stop sharing. There we go.
No, I'll let you finish that. We have a little bit more time. I actually was curious myself. You said that you serve veterans. Do you find that there are a lot of veterans that either are unable to or don't know how to access the VA services there in Oklahoma City?
Yes, there's, and a lot of times too, they just don't know if they're eligible for services, or they just don't know where to access or who to talk to and things like that. And so we really try to connect them to the appropriate people that can get them into, if they're not eligible, at least see if they're eligible for other things, other services and things like that. And so we really try to get them connected. But that is something that we see quite a bit, or, there's, veterans that come in, they don't talk to anybody. They don't, they don't tell them that they're veterans. And so we really try to utilize our day shelter in that aspect of connecting them with advocates. So they could be like, well, actually I am a veteran and I've been experiencing homelessness for 15 years now. Yeah. And so it's like, okay, well, let's get you somewhere, and so that's the hope.
Caitlin wants to know if you have a list of resources just for veterans on the website, or where one could be found.
I don't have necessarily a list. We have a contact with the VA and that we connect them with, but I can, if you would like to email me, I'm more than happy to send you that list, or, some resources that you can have.
Okay. Any other last questions? One quick burning question I had. I know that you said you got some extra funds because of COVID.
Yes.
Those funds are time limited. Anything that going forward, thoughts about how that'll continue?
Yeah, so we've definitely been brainstorming and seeing if there's any other grants and things that we can access through that. And really that goes into just like collecting data too, and just seeing like, okay, we were able to assist this many people within a year, and then we can present that and hopefully, be like, this is a need that we're really looking into, because our hope is that if we can help individuals to, not have to be unsheltered or get them while they're at imminent risk of homelessness, that would be the best thing, right? A lot of times too, because of COVID, a lot of people did lose their, they lost their jobs, they lost all these things. And so if we're able to step in and, have someone not get evicted and now have an eviction record, now have all these things, which then ultimately creates this rippling effect. And then they end up, on staying at shelters or on the street or in their car. And so the hope is that by stepping in, and then we really have been working also with community cares partners. I'm not sure if that's something you guys have heard. We really have been trying to build that relationship with them too, so that if we aren't able to assist, then we can get them connected to them, and they're able to provide that, funding or, that month's rent for a longer extended of time than what we may be able to, which is awesome. Yeah.
May, this was speaking for myself, and it was an excellent presentation. I truly appreciate you taking the time out of your day and maybe probably your lunch hour.
No, you're good. Yeah. No,
present the information for us.
I am super happy to be here and, share this. We love what we do here as an agency, and we really try to get our community involved in some way. And like I said, if you guys do have any questions, please feel free to reach out to myself or to us. We're always happy to have it. If you guys, are wanting a tour or really just like volunteering, engaging in some way or another, we can definitely get you connected as well. So thank you for taking the time to listen to me.
Yeah, you're getting a lot of thank yous. Very, very, very informative. I'm going to put the CEU link in there, and I'm also going to put, please type your complete name in Zoom, as that is how we will take attendance and, to make sure that you're here. If anybody doesn't have a last question, I will, actually, Melody, I think your name is on your profile. That's how we pull the attendance, but I think you're good to go. Let me check real quick. Yes, your name is there, so you are good. And so just to be clear, I didn't mean to type it in Zoom. I think I wasn't, like when I teach sometimes, I wasn't making myself entirely clear. But I thank you so much. And would one of my co-workers, either Mr. McCoy or Ms. Tarpley, I'm ashamed to say, I do not know what the next session is at 1 o'clock. If either one of you would be willing to pop in and tell us that.
Yeah, absolutely. Thank you, Charlotte. So our next presentation at 1 o'clock is going to be Food Insecurity in Oklahoma by Joy Farron. So if you guys want to take a quick break and log back on just before 1, that one will also be eligible for CEUs.
All right. Thank you so much for y'all being here, and I hope you enjoy the rest of the day.